We'll begin in just a moment.
Can you send Zach the panelist link? Did you see that? Okay.
Welcome, and thank you for joining us today for the first installment of the hospitality session for our Boulder County Public Health feedback sessions. My name is Corinne Waldow, and I'm with the Economic Development Director of the Boulder Chamber. We want to thank businesses for engaging in this process and for continually asking questions and getting the right information on how to open safely in our coronavirus economy right now. We also want to thank the other chambers, economic development partners, partners like the Convention and Visitors Bureau, for getting information out to our businesses. I also want to thank Boulder County Public Health for continually giving these updates and providing opportunities for businesses to ask their questions, get information as it comes out, and to give feedback. These sessions will be weekly, and we want to encourage you to participate because the orders will change, the environment will change, so you need to get this information so you can safely reopen for both our health and our economy. At this time, I'm going to pass it over to Ambra, who's with Boulder County Public Health, to talk a little bit about the hospitality industry.
Thank you, Corinne. Well, first off, I just want to recognize the Chamber for all of your great leadership in hosting these seminars to help businesses really open safely and work with us, to get the information out and just to make it safer for everyone and for it to be successful in phase 2. We want to make sure that you have the support and the resources that you need, and we'll be sharing a Q&A from the next session into the session next week. So please put your questions in the Q&A section of the presentation, and we'll discuss those later. So with that, I just wanted to say who is this webinar specifically tailored to? So hotels, motels, places of accommodation. This checklist is not for homeowner rentals, short-term rentals such as Airbnb or VRBO, and privately owned residences for rent. The agenda and purpose of this, so we will be discussing face coverings, a safer at home overview, resources to support you, and then we'll be doing a Q&A session at the end. So what is the long-term outlook for safer at home? Basically we're at a point, level 2, and we're not immediately going back to where we were in January or February. So this is a whole new way of living and doing business. We still strongly advise people to stay at home when they can. Critical businesses are open and limited non-critical with precautions. And just knowing that we'll be under the safer at home order for quite a while. So expect months and not necessarily weeks under this. And then, certainly there is no guarantees that we will not go back to stay at home if it looks like the COVID illness is increasing. So next, the face cover order went into effect on May 9th. And face coverings are currently required outside of the home in the Boulder County, and if you cannot maintain 6 foot from someone else. So thinking, crowded retail stores, obviously, and like trails where you would not be able to maintain that 6 foot distancing. Some exceptions to this are if it's not safe. So for a safety reason that wearing a mask, say if you were doing some kind of construction or a medical reason, then you would not be required to wear the mask. If you're working alone, so say you're just alone in your private office, you would not be required to wear a mask at that time. It's really just anytime you can have person-to-person contact is what we're looking at. And then children under 12 are not do not have to wear a mask unless they cannot maintain the 6-foot distancing. So what does safer at home look like? So as I mentioned, you're really just trying to stay at home as much as possible. We are, open with restrictions. So remote work is recommended. If you can still be working at home, please continue to do that. This is really a new territory for many businesses. I know that hotels and motels have been deemed as a critical business, so maybe they have had some of these practices in place already. But for many businesses that just opened up last weekend, this really is a new territory. And then some high exposure risks still are permitted, are not permitted. So large events, gyms, and restaurants are not permitted at this point right now. So what can the hospitality industry do right now? So as I mentioned, most of these businesses were deemed essential prior. And so some of the services that have been expanded as increased workforce returns are retail, personal services, and you might find these embedded in hotels and motels as well. And reviewing the compliance checklist. So I believe that Corinne went ahead and sent the checklist out, but basically compliance with the orders is mandatory. Use of the checklist is voluntary, this posted on the website, but some of those do fall under, some of the items on the checklist are part of CDPHE's orders. You can use this checklist as a compliance aid, a communication tool between you and your staff and your customers, and then comes with a public poster. And enforcement, so what does it look like? So we start with asking for voluntary compliance, and then our goal is to really inquire and educate first. So we may send you the checklist, just to look at some of your practices if you're not currently in compliance, and we may ask for that checklist to review with you if we do get some complaints. And then lastly, we would just issue orders to close, and civil action is possible if you continue not to be in compliance. And then just one last note, Boulder County Public Health cannot provide legal advice. So compliance is obligatory. We're working to compile some standard guidance with the attorneys, and we may need to supplement or change guidance just based on, sometimes it's day-to-day things change in this fast-paced COVID world. So, and then any additional questions about compliance, we really are encouraging you to contact an attorney for some of those really sticky gray areas. So reviewing the workplace checklist. So this is really just, the workspaces within the hotel, motel, and we can just run through these. These are all listed in the checklist, and there are some additional best practice checklist items as well. But deputize a workplace coordinator charged with addressing COVID issues, implementing symptom monitoring protocols, temperature checks, and then just realizing if you do have 2 positive cases, you do need to report them to Boulder County Public Health. Maintain 6-foot distancing and discourage shared spaces. Provide appropriate protective gear like gloves, masks, face coverings, and advise on appropriate use for those. So just educating, your staff on those. Frequently sanitizing all high-touch areas, shared equipment, and common spaces. Ensure proper ventilation, and you can use the OSHA guidelines for that if you need more clarification. Post bilingual signage for employees on hand washing and COVID-19 safety protocols. And avoid gatherings, meetings, in break rooms, lounges of more than 10 people. And then lastly, for your offices, follow the office guideline checklist that we have posted on the Boulder County website. And employee checklists. So still maintaining social 6-foot distancing is required. Meetings, person-to-person interaction, and no meetings or trainings of more than 10 people. For PPE, really requiring them to wear facial coverings, masks, and gloves, and encourage appropriate use. And there are several, training videos out there on how to put on masks, how to remove gloves. So make sure you're using those when working with your employees. And then sanitation, constantly requiring proper hand washing and reminding people about hand washing, and then sanitizing equipment, especially, any shared equipment. And then employee wellness temperature checks daily and have a COVID-19 plan for illnesses in place. Require employees to show any symptoms or any signs of sickness, or if they've been in contact with anyone that has been tested positive. And contact employees refer employees to a company or state benefit providers. And then lastly, encourage and enable work remotely whenever possible. And here's the customer checklist. So installing shields or barriers where possible between customers and employees. So you might think, maybe at the reception station, if you do have a retail store within the hotel, looking at maybe installing one of these at that point as well. Providing paperless estimates, invoice, and other documents, and use contactless payments whenever possible. Provide hand sanitizer to your customers at the entrance and at the check-in reception area. Perform routine cleaning and disinfecting of frequently touched surfaces by customers, employees, and clean between each customer at the register. Maintain 6-foot distancing at all times inside of the business for patrons. And then PPE, just requiring face coverings and masks in all public areas. And then lastly, educating customers on local safer at home requirements, protocols, and when they're venturing outside of the facility. And we have also provided some additional resources on the checklist sheet. So for housekeeping, there are cleaning and sanitation guidance. You can also use, CDC, DORA, and Boulder County. We also have some of those resources on the site. For spa service guidance, you can use the personal service checklist for those areas. Hotel fitness centers are open with restrictions. However, no pools and hot tubs should be in operation. Hotel guidance, restaurant guidance. So currently, they're only allowing takeout, delivery, and room service, and no patio dining. And hotel retail store guidance. We do have a retail checklist that's on the website that you can use for that. And then local and personal recreation. DORA has provided some of these, so as you do have visitors, you can recommend some things that they should do if they're out hiking around or going on some trails or just recreating in general in Boulder County. And this is just some information on where you can go just to get a little more guidance. So bouldercounty.org, definitely the Chamber of Commerce, industry associations, look for those. Licensing agency, city, covid19.colorado.gov, Center for Disease Control and Prevention, so the CDC, Department of Regulatory Associations, DORA, Occupational Safety and Health Administration, so that's OSHA, and then lastly, Energize Colorado. They are creating a marketplace for some PPE and some where you can obtain some of those items. And so now we'll go ahead and take your questions, and then if you would like to contact us after with any additional questions or suggestions, you can reach me at covidbiz@bouldercounty.org. And we do have a call center line that we maintain too. So if you just have a quick question that you need answered, then you can call that as well. And then lastly, our next session will be next week, the 21st, same time, and you can register on Boulder Chamber for these events. And we will provide, a Spanish session is being provided for all session on Wednesday at 6 p.m. So with that, I'll turn it back over to Corinne.
Thank you, Amber. There was some confusion about logging in, so I just resent the login. So we might have some questions trickle in. First, I'm going to have Zach talk a little bit about this May 26th date that people are hearing the governor talk about and what that really means.
Sure. Thanks, Corinne. Hi, I'm Zach Swank. I work with Boulder County Public Health as well. So May 26th is when the Safer at Home order expires, and also when the governor is indicating that he will have an update on what the next steps are. And I know, as always throughout this process, everyone wants to, to have tomorrow's information today. But one of the challenges that we face in, getting guidance out sooner or, knowing what the next steps are is the incubation period of the virus, which is 14 days. So Boulder County went to safer at home last Saturday. That means that with a 14-day incubation period, we won't know until the 23rd, if someone got sick on last Saturday. And so that delay makes it hard to plan for events and other restrictions without a few weeks lag time to see the impact of the changes that we've made. And so right now, we are restricted to gatherings of no more than 10 people. If we see a positive trend in terms of a decline in cases, a decline in hospitalizations, and some other criteria that the governor laid out, I would think that we could expect to see a loosening of those restrictions. But conversely, if we see the opposite and case numbers are going up, then we're going to have to react to that. So it's a bit hard at this point to predict what the situation will be for events after May 26th until we get there and until we get the data of how the transmission rates are going. And quite honestly, we may see opening up a little bit for events. Looks like things are going good. And then if there was a spike in cases, then of course we would have to look at that and dial back down the opportunities that we're creating for more transmission of the disease.
Just for the benefit of the people that just joined, Amra, because I accidentally sent the wrong information out when I sent the reminder. Can you talk about where to find that checklist and what the checklist includes for hotels and motels real quick?
Do you want me to go ahead and share my screen? Would that be best?
Yes, please.
Okay.
And for those of you just joining the call, the hot off the press is the industry checklist of requirements under the order that you can use to make sure you're following them.
Right. So it's under the bouldercounty.org /families/disease/COVID-19 and then guidance for Boulder County Safer at Home. So, and then we do have the checklist. So under this guidance for Boulder County Safer at Home order, if you click on that, you'll get down to this point. So here are the checklists, and we do have the hospitality industry checklist. So that's where you can find that. And then we've also added, there is this special events guidance document listed on there as well.
And for people's reference, we'll be sending all those links out in an email following. Zach, could you talk a little bit about face coverings and how you talk to people who aren't wearing them, or what are some suggestions you have for companies in dealing with face coverings?
Sure, and maybe Amber can show the document that we have for a sample script for communicating with customers who are not wearing face coverings. But in general, we have our Boulder County face covering order, and then there's also face covering restrictions under the state order. For the most part, those should be aligned, but there are some scenarios where they may not be. We are working on producing a guidance document clarifying those common scenarios. For example, one would be under personal services, the state's order says that if you're getting a haircut, you have to have your face covering on at all times. Whereas Boulder County's order says you only have to have it if you're going to be within 6 feet of other people. So, if you were in a waiting room Would you need to have it on? Because the state's order is more restrictive, yes, you would. So we're helping to clarify those scenarios. Also, what Amber has pulled up is a link on our same Boulder County COVID page that's just a sample script for you and your employees to practice having conversations with customers, or think about how you might have those conversations with customers if they attempt to come into your business without a face covering when it's required.
Thank you, Zach. So on the call with us today, we also have Marianne Mahoney. So Marianne, if you want to show yourself.
Okay, there I am. Thank you. Hi, everyone, and thanks to Corinne and the Chamber for hosting all of these great webinars. And also, these are available to review again and share because this information, it's not to say you haven't been doing these cleaning checklists, but now it's kind of the Department of Health who is really requiring all of these things. What we're seeing in the research from visitors and how they feel safe, nobody feels safe right now. And so communicating that your establishment has complied with these things is going to be really important as we move forward because everybody has a perception that they're not safe. So if we can give them assurances of what you've been doing every day, but what you've been doing extraordinarily that you've added to your practice as a Convention Visit Bureau, we're going to be asking you that so we can post these items on our website for the consumer to really be looking and having as much information about your individual properties that you've gone this extra mile. So one thing I like about this, and I didn't ask for this, but the signage that Corinne is going to send to you and show you, because the retail establishments will have them and restaurants will have them, I think it's great that the consumer will get to see that the signage is similar to all of these signs around the community and around Boulder County to be able to say, all right, they're following the standards that that have been made by the health department. So I'm really liking that piece. I know some brands have a difficult time with signage, and I think that should be a conversation kind of, within your brand, how and why and how you can be able to help with this information for the consumer, I think will be important and kind of bring back to this group during a further discussion.
So Marianne, you just gave me a segue, so I decided to share my screen. So we've already got a couple questions in here about, receiving the guidelines that were brought up. So you'll get an email. This is your guys' first session with us, but we will send out an email afterwards with a recording of this video, the resources and links that Amber talked about. And in those links are access to signage that we created for cross-industry. And it's for all of Boulder County to kind of establish what Marianne talked about, that trust, that you're assuring the public that you're following the checklist, and also providing the signage that's required in the checklist. Don't avoid groups, social distance, wash your hands in the bathroom and how to wash your hands, how to put on masks, things that you may need throughout your building. And I know there's brand issues, but we tried to make it consistent so you'd see a retailer and a restaurant in all of Boulder County using the same signage. In addition, there's a sign that says open for business. And this sign basically says for our health and for our economy, we are following the requirements of the state and the county. And this is your way of self-certifying that you're following the checklist. And you can print these out on 8.5 by 11, or you can print them on larger sizes, but they're available. We also have them in Spanish. So you'll get a link to the Spanish version, and all of the translation has already been done for you. So please use the signage. We'll be working with Marianne to see if there's any specific to the hospitality industry we would need, but this is available to you right now and you'll get a link to it. All right, so I'm getting questions via email as well as Q&A sections, so let me try to check that. In the meantime, Zach, while I'm doing that, will you talk a little bit about the survey you guys are gonna be doing?
Yeah. So keep an eye out tomorrow. We're sending out a survey. It'll come through the chamber and other sources of wanting to understand what compliance levels you're seeing with customers coming into your business wearing face coverings, as well as customers observing physical distancing in your business. And the reason we're asking for this input is to better understand how effective these measures are in terms of compliance and how much they're contributing to controlling the spread of COVID-19. And we will use that information going forward to help inform our guidance and the future evolving nature of Boulder County's face covering order. So your input really helps us understand the challenges that you're facing, as well as what the conditions are in the community and how effective these measures might be. So keep an eye out for that, and we thank you in advance for your responses.
All right, I have a ton of questions for you, Amber, now, so ready?
You're ready.
Okay, great. So in the Safer at Home checklist, the word encouraged is used many times. What do we need to actually require?
So if you look at the checklist, we do have, I can probably
I would bring it back up
real quick. And
while you're doing that, do all guests need to wear masks to enter our hotel and be in the public areas such as hallways, stairways, etc.?
yes, that would be required. All public spaces. So obviously not in their rooms, right? But any kind of shared spaces, the lobby, the elevator lobby, they would be required to wear the mask there. So under this, if you look at requirements for the workplace, these are the ones that are the state requirements, and then best practices, those are just encouraged. So everything that's under requirements is the state, and then just best practices.
So you have it broken up into 3 sections. So you have requirements for the workplace, requirements for the employees, and requirements for customers.
Correct.
And so they need to follow all 3 sets of those requirements.
Yes. Mm-hmm.
Okay. What are some best practices that hotels are doing about those common use areas, areas that you don't even think about people convening?
So just a couple of things that I mentioned are, you want to think about the lobby furniture was one thing that, we had suggested maybe roping that off just so people aren't using it. Otherwise, you have to really keep up on them, maintaining and cleaning those and sanitizing those basically after every use. So, just thinking about that. Another thing is if you have like a beverage service, coffee for guests when they come in, just eliminating those, or just to have those provided, the receptionist gets you, say a glass of water or something, so that you just don't have it unmanned and, people are touching things. Those were a couple of things. Was there anything else that I recommended? I think the other thing is just really maintaining the line at reception, maybe getting some of the theater ropes put up so it's elegant looking, but it's maintaining social distancing, and it shows where people where to line up, and putting some non-obtrusive markers like on the floor for social distancing. I think those are just, there's others on here, but that's just highlighting just a few of them on there.
Amber, there's been some during the retail conversation, traffic patterns and things like that. Could you address that in envisioning a hotel lobby or entering a hotel?
Yeah, I think
for traffic.
Yeah, even, if you have, 2 sets of doors, like one's in, one's out, just to, So you're thinking about, people coming in and social distancing. And then they have been putting arrows on the floor just to, like a one way of how the flow is going to go in the retail stores. So maybe that's something the hotels could adopt as well.
Thank you.
All right, we're going to continue on the hotels for a little bit, and then I have to come back to events. When we have a couple questions about logging employee temperature, how to do that, kind of showing a little bit of the guidance on what you should do there, some best practices.
Okay.
Maybe show the log.
I'm going to try to see if what we have on here.
You have a link there's a link to,
I'm trying to remember where it is.
yeah, it's under that guidance. Well, it was under the guidance.
It's under the Colorado guidance. If you scroll down, Ambra,
Okay.
There we go.
and then it's symptom screening. Yeah.
I knew it was there somewhere. So yeah, here's, it outlines it pretty well. And then certainly if you have any questions, you can contact us. But you just basically the equipment that you need, personnel, data screening. So.
And there is a form, there's a link to a form on there to help you record those. Some best practices and legal requirements are, don't make this a public form that everybody can see, because you want to share your employee health information. Zach, maybe talk a little about best practices of identifying an individual point of contact to collect this information, or some of that might be helpful to this group.
Yeah. And Amber, while I'm doing that, can you go back to our website under the Boulder County Guidance and Tools?
At the beginning, or this one?
Yeah, so the second item there, that ADA guidance about employee health information, this is an exhaustive. I admit it's quite lengthy, but the good news is that it's got a lot of great information about how to properly collect and maintain and store health information for businesses that are not required under HIPAA. And HIPAA is primarily just for businesses that are, doctors' offices, et cetera, that are dealing with health information regularly. So that is a great resource. And then as far as, collecting this information, having it centralized, having a single person do it. Amber talked about, designating a COVID coordinator helps, both, privacy information, having a single person do that, and also helps reduce the potential for spread of disease if you're taking temperature checks. Only one person is touching that thermometer, et cetera.
All right. And thank you for showing these resources. Again, we'll send a link to the log and this site, as well as how to take, how to do the screenings and do checks there.
So Zach and Ambra, hotels usually have 3 shifts.
Mm-hmm.
And sometimes the third shift is 1 or 2 people.
Mm-hmm.
Do they check each other? I mean, I'm just trying to kind of envision our night auditors and I mean, just try to think about how some of our how we work.
Yeah, you definitely have to address that, per shift,
Okay.
right? Like rather
Okay.
than just having one person covering, the whole time, but you have,
Right.
Per
Yeah.
shift, designated person.
Okay.
Mhm.
All right. Thank you. Corinne, you got lots more?
I have one more question that came in via email, so let me get to that, and then we'll go back to Marianne, if you have some questions, and then we'll go back to the question and answer. I understand that we have to post signage advising the correct disposable of gloves. Is that correct? And then do we have signage on that, or how to correctly dispose of gloves?
There are really good videos out there that you can find. I think the CDC website has a really good one, but there are, some really great videos that I would just suggest showing your employees on how to properly remove gloves. I believe there's also a poster out there that I've seen that just shows like a brief of how to take them off.
This
Do
might
they
be
have to
one that we
Do
can,
they have to be disposed in a certain way, Ambra? I mean, do they have to be kept separate or anything, or they can just go in your normal?
No, I think they can just go into the normal
Okay.
land or trash can.
Okay,
Yeah, they don't have to go into a medical bag.
okay, thank you.
And on the requirement of, signage about how to dispose of gloves, we would want to look into that. That's not something that I'm familiar with. I don't know about you, Amber, but we would
I
want.
haven't seen any specific, disposal of gloves. I mean, as
Yeah.
far as I know, they can just go into the normal trash.
Okay,
Not like medical waste.
And if anyone has, whoever asked that question, if you would send us an email at covidbiz@bouldercounty.org with where you saw that information, we'd love to follow up on that to better understand.
I was speculating. Sorry, Zach.
Okay.
I'll send the asker a question. We have gotten questions from other industries, other businesses about, proper usage of masks, proper usage of gloves, because it's not something we do on a regular basis. So a lot of those resources are out there, and education is a good tool for your employees. Because Zach's described in the past the cross-contamination of taking masks off and putting masks on, and just making sure that you're aware of where you can create that cross-contamination. All right, back to events. I know you don't have a crystal ball, Zach, but any idea of what the stages might be for events or gatherings? Is it 10 to 50? Is it, in the stages? I'm just gonna ask.
Yeah.
I know it's hard because you're going by the state order, but.
Well, yeah, it is hard, and it depends on the direction of the disease. I'll say that I decided that I needed to cancel my wedding for July. That not necessarily an indication of what is absolutely going to happen, but it didn't seem to me like it was going to be likely that was going to be achievable. I can say that we, with any change, we're going to need at least 3 weeks to observe what are the effects of that change, right? Because you make the change day one, people are able to get out more or do whatever more. So you need a week of that activity happening, and then you need 2 more weeks to see, what was the contagion level that was happening under those new revised activities. And that's one of the things that makes this so hard to say, okay, what is going to be the next stage, and then what's going to be the stage after that is, we really need 3 to 4 weeks at a minimum between the loosenings of restrictions to evaluate what impact that had on the degree of contagion. And so, predicting when we might be able to have, gatherings of 50 or 100 or more is really, really challenging to do. And I would not, even hazard to do that at this point, because it really hinges so much on, what happens in the intervening time. So I know that that's an unsatisfactory answer. We do have on that same page that Amber is looking at there, there is a special events guidance, the link third up from the bottom there, that has some additional info. It is not going to tell you, when you can have a gathering of 50 people, because it is just so hard to predict. And I know that that's something that everybody wants to know, but we just can't say at this point.
So Zach and Ambra, I had had a conversation with the State Hotel Association to kind of start moving forward of when we're talking about gatherings and the number of people, is that going to, I think everybody, if you can feed this up to the top, everybody would be interested in having it broken down by square footage instead of, this is because some of our hotels have meeting space, and as those numbers scale up, they might use a whole ballroom for that scale of number of people. And as long as we're thinking about how people are coming in to the meeting and not clustering and people exiting and and all of the, no coffee stations and self-service stations, but also thinking about safe distancing, because we know that everybody's going to want to try to provide space for canceled business, but have some predictability if it's based on square footage per person or something like that. So I just want to, and some of the hotels may want to pipe in with that thought, or is that for another week and another week and another week?
Thank you, Marianne. I think that's really good feedback, and a point very well taken. We'll definitely, communicate that in our communications with the state. And I should say that, on events, we have a member of our team, John Holstein. Many of you may know him if you have done larger special events in Boulder County in the past, who is focusing exclusively on events, and is the one who helped put the guidance together that Ambra has up on the screen. And so we do have a part of our team that's dedicated and devoted to this issue, and trying to crack this nut. But but that your point very well taken. I'll definitely pass that along.
Thank you.
Zach, can you talk about maybe about how we could use these calls for feedback and how important it is to stay involved and provide feedback on future calls?
Yeah, well, I think Marianne's comment is a great example. We started out some of the other sessions with an explicit feedback listening session. We're just obviously starting this one for hospitality now, but I think we do want these to be a two-way street and a forum for communication. So please chat in your questions. If you have other comments, you can use the covidbiz@bouldercounty.org email address to reach us with additional thoughts that you may have. As Marianne, as you just saw, with Marianne there putting something on our radar that was not something that personally I had fully considered before. So all of that information is to help us. Your businesses best more than we do, and so the more information you can get to us, the better we'll be able to help make sure that we can help shape the state's guidance, and then create the resources to support you in complying with that guidance that you need.
And if there is some assistance, because I think the Boulder County is usually used to outdoor events, and these, if we need some context, please call on us, because there's a lot of industry professionals that can help context, because ultimately it's about our guest safety.
Yep.
And employee safety.
Yep.
And so if we can kind of envision and provide that context, and again, through these conversations, I think we'll kind of dig deeper and find out some of that.
So we got a pretty specific question, and I think it gets to the point. It's asking about when we start doing gatherings, will there be guidance on how far apart people can be, how many people we can have inside and outside, if we can have a buffet. I know you can't answer those questions right now, but is it the hope that once things, then at each stage, there'll be that type of guidance provided to facilities to be able to plan? And just like we've done with some of the other industries?
Yes, absolutely. I think some of the things you can, reading through the question here, how would we set up the bar area, the buffet, how would we do 6 feet between guests, seated at a table, at a dance floor? That specific information has not been, well, it's going to come from the state, most likely, and not from us. But you can imagine, what you're going to need to do there, right? Like, how do you do all those things and maintain 6 feet between individuals? And I know the question was to me to answer that question for you all. But again, your business is best, and you're most well positioned to begin to imagine how you might accomplish those things. But certainly, when when larger gatherings are allowed, there definitely will be requirements, clearly spelled out. And then, as you can see from, the Boulder County page that Amber has pulled up, we will do our absolute best to assist you with additional guidance and support and clarification when the actual order itself leaves things a little unclear.
I can attest, we had retailers last week wondering how they were going to get sneeze guards or plexiglass, and walking them through that process, walking them through the directionality process of the new requirements that hit. So hopefully through these webinars and these opportunities, we'll be able to get the information out, but then also provide guidance and some best practices, because we've seen that some industry sharing between is important. I think it'd be important to clarify the indoor-outdoor events have the same guidelines right now, that you talked about earlier.
Yeah, that's correct. A maximum of 10. I would expect that outdoor events might loosen up and increase in size before indoor events do. The evidence of outdoor spread of COVID shows that it's significantly lower than the indoor spread, which makes sense, right? Less things to touch outdoors, and also you don't have the same air recirculating through. So I think it would be reasonable to expect that outdoor events would be more possible sooner versus indoor events.
And in that event, I think this group would probably need to be apprised as if things change as far as food service. A lot of our hotels have outdoor areas, so we probably will need to cover that if something changes with that.
Yeah. And on being apprised, it is our intent to be able to provide information well in advance of a change in order. That is a part of the reason why Boulder County extended its stay-at-home order by 2 weeks. We needed to get more testing in place. We needed to have more contact tracing and a few other things. But one of the other things we recognized was that the state the state issued their guidance for Safer at Home the same day that Safer at Home became active. And we understand that the challenges that makes for individuals in terms of planning and wanting to open and being ready to go. And so we will do our best to provide that information ahead of time. However, insofar as we are relying on the state for a lot of these orders and declarations, much like as everyone else is, sometimes in the past we've not gotten much heads up. So we'll do our best to get you the guidance ahead of time so you can prepare and plan. We know how important that is, but I can't guarantee it.
Another thing is, in this industry, we're usually communicating with our guests because they've made reservations. So there's an opportunity to pre-inform our guests what to expect and all of those things. I mean, it's not about no, it's about your safety and our safety. And so I think we do have that, whereas in a retail store, you just don't know who's coming in. Usually a hotel guest has a reservation. They've had that communication. So we have that opportunity. And again, some hotels may be providing face coverings for their guests, and other people will, anticipate that their guests must bring them. So again, it's up to each ownership and managers to really communicate to their guests, so there's no surprises. I think that that's probably the best thing, and I think everybody will feel more comfortable knowing in advance that these orders are in place.
Yeah. All right. Well, we're actually past our time.
Okay.
We will have these calls weekly. I'll send up a follow-up email. If we didn't have a question that was answered or it was very technical, one of the things that we've done on each of the webinars is kind of look back at the questions that were asked the previous week and see if there's been answers that you can provide. And then in the future, if we see we need to do a breakout for events, we might have to do that specifically, different than maybe the hotel motel, just the space piece of it. Do you guys, any of you have any final thoughts or words you'd like to give before I close it out? All right.
Really,
All
really
right, well,
happy so many people are on this call. Thank you all. And thanks, Zach and Ambra and Corinne for doing this. These have been very helpful.
thank you, Marianne. And I want to thank everybody that attended in learning how to safely reopen, to ask your questions, to provide that feedback. Captured all that feedback, and we push it to Boulder County, and then Boulder County is doing their best to push that up to the to Colorado and to the state. Again, register weekly. I want to thank all the chambers, our partners, the CVB, the economic development agencies for really trying to get their businesses engaged in these. And I do want to do a shout out to Boulder County Public Health. This has been a very trying time with a lot of questions. I know I've sent you hundreds myself, and you've worked through them at the best you can, and you've provided these dedicated hours to really speak to the business community, and we appreciate that. We'll hope to see everybody next week, and have a wonderful afternoon.
Thank you, Corinne.